मेरे स्टाफ लाइव देखना चाहते हैं, कैसे देखेंगे?
Okay, I think we are live now. Hello everyone. This is Dr. Minal. I am co-founder of Epione Pain Management Center and consultant pain physician here in Hyderabad. With me is Dr. Chetana Chetan. She is the clinical head and senior consultant pain physician at Epione Chennai. And both of us are here together because we deal with a lot of patients of chronic pain, and our most of the patients are female. And we thought that this Women's Day, let us both together just create a little of awareness about women's health, because what we have been seeing in our practice is a lot of women suffer, most importantly because they themselves do not take care of themselves. So we are here to talk about any kind of pain patients are suffering, especially in women. And let's get started. So Dr. Chetna, what is your experience? Would you like to share something with us, experience of getting pain, and
Hello.
Dr. Chetna,
Hello, am I
okay,
audible?
meanwhile, Dr. Chetna is yes, well, I think more to people who are right. So all friends who are watching us live, we treat all types of chronic pain, and instead of chronic pain is because of spine pain, because of joint pain, because of any other musculoskeletal condition. But what we see in our practice is a lot of females come to us. So it's not like male is stronger, female is less stronger. That is why the females are more prone for any kind of joint pain. It is because the females themselves do not take care of of themselves as much as they are supposed to take care. And that is why we have lots of female, who comes with knee pain. And the literature also shows that, the incidence of knee pain is more common in females. So, Dr. Cheta, would you like to enlighten us with your experience in Chennai?
Yes, many people, many ladies are suffering from knee pain, mainly because they're not taking care of themselves. If the care is taken at the right time, we can avoid so many problems reaching to a stage where surgery might be dictated. So self-care and self-love, these two are the things which can take you to with a healthy lifestyle and avoid many problems in your life.
But when you mention self-care and self-love, don't you think as a woman, when you want to think it, you think that you're being selfish, and that's the reason why females don't take care of themselves, and then they eventually land up to so much of chronic conditions.
Self-care is self-respect. Somebody is calling us selfish, that's their point of view. I feel self-care and self-love are the two things which can keep you healthy.
Yeah,
So I
that's
think
right.
every woman
Uh,
should do it.
yeah. So, what kind of patients you see when patients come to you? What kind of patients you see there, and what are their general conditions? I'm talking about mostly. Let us concentrate on housewives. Because they are the ones who take care of them least. They are more worried about what's happening all around around in the family. So, what kind of patients you get? What are the general questions they ask for, so that we can discuss and we can benefit a lot of audience who are watching us?
Okay, they usually come with the knee pain, and most of them they're having problems because they're not able to go and see a doctor. They don't want to go and see a doctor for the reason that doctor might tell that yes, you require a surgery. That is the reason why many of them are not taking care of themselves. They're trying all the home remedies, trying all online remedies, whichever is possible. So they're taking care of the pain, but not attending the pain on right time with right treatment.
Correct. So what I have seen in my practice here in Hyderabad is most of the patients come with knee joint pain. So knee joint pain, one of the most common causes osteoarthritis that happens because of aging. And initially, I think a decade or two decades back, it was population of above 60 who used to come for knee pain. But now what I'm seeing is the trend in young patients, 41, 42, 45-year females coming to knee pain. And the reason is degeneration of cartilage. That is because of, excessive strain that is happening to the knee joint. And because of that, even 40s and 50-year population patient females are coming to knee joint. So how would you like to address them?
Maintaining a good health, a healthy lifestyle. That is like most of the problems in our life is 40% of the problems are mainly because of the genetics and because of the surrounding environment. But 60% of the problems are because of a healthy lifestyle. If we are able to maintain a healthy lifestyle, we can avoid many problems in our life. So taking care of yourself is a prime thing. That is giving adequate time for yourself and addressing the problems on right time. Avoiding few things in your lifestyle will help you to remain healthy. Prevention is better than cure. So the problem has to be addressed before it comes.
Yeah, so just to tell, what is knee osteoarthritis? Knee osteoarthritis is a degenerative condition of wear and tear, where the cartilage, which is like a gum-like structure between the two bones or in between the thigh and your leg, gets degenerated. Now, why it gets degenerated is because it's an aging process that will happen. The wear and tear will happen. But the thing is, in few patients, it happens at the age of 50. In few patients, it starts at the age of 60, and few are good up to 70 or 80. As compared to males, the females are more prone for this. Why females are more prone for this is uh, because of the excessive activity, the excessive strain they keep on doing, they keep on doing. The more you strain your joint, the faster it will degenerate. So the degeneration process will actually start at the age of 40, 45. Some may get pain at the age of 50. Some may get pain at the age of 70. Some may get pain immediately after 40, 45 years. Osteoarthritis is something that every human we have to go through. It is we make our joints more healthy and taking all the precautions so that whatever is this natural process of degeneration, we can delay that. So there are few important precautions like females can take care to like Dr. Chetna was mentioning, self care, take care of your things properly, weight reduction, keep your weight always at check, do not do excessive climbing of stairs because there is a myth that you take more stairs you will be more healthy. That's a wrong notion. After 40, 45 years, try not to strain your knee. Whenever you have that option of lift, you try taking lift, doing a regular exercises, keeping your joint mobile. Stretching exercises are very, very important. Going for a walk is okay, but you only need to walk till the time your joint is allowing you to do, because a lot of patients I have seen who try to force themselves for a walking for 2 kilometers, 4 kilometers. So that's a wrong thing. Please do not force yourself to 2 kilometers or 4 kilometers walk after the age of 45, 50. You walking till the time your joints are allowing you to do. And when you go for a walk, please do wear a good footwear, because wearing a good footwear will, take friction that is generated. And always try to walk on a smooth surface. When you go to gardens, when you go to the park, you will have a rough surface and then you get track, which is made for walking. So always try to walk in the good smooth surface so that the friction generated is not harming the joint as much. These are the things that I'm telling you for taking care of your knee joint, because knee joint is one of the is a weight bearing joint and very prone for osteoarthritis. So the incidence of osteoarthritis is very, very high. And early age female of 40, 45 years, and I've seen a school teachers who have a lot of standing work. They do a lot of training. They have to climb from one class to another. So whenever you're doing all these things and you have pain, do see your doctor as soon as possible, because what we think is, let us go for home remedies. So with home remedies, they'll try to manage the pain, and whenever they have excruciating pain, they'll start taking painkillers. So that's a wrong thing. Please do take care of your knee joint. Whenever you have pain, you visit your physician. They will see you. They will tell you, get a scan done. They will tell you what is the damage according to precaution. Accordingly, you can take the precautions. And weight reduction is very important. Do not strain your knee as much beyond your capacity. So all those things are going to help you in long run to protect your knee and delay the process of osteoarthritis. And Dr. Chetan, what would you to add in this? And how can we help them further as pain physicians?
Yes, taking care of good bone health would help many of us to tackle the pain. Like following this simple rule of 8 hours of good sleep, having minimum 8 glasses of water a day, walking preferably if possible in eight shape, that is what is called as infinite walking, and having adding eight possible food items in your diet, like milk products, butter, cheese, buttermilk, paneer, tofu, vegetables, fruits, and dry fruits. By following these simple steps, you can maintain a good bone health so that we can avoid pain at an early stage. Also, if avoid
Yeah.
smoking will.
Yes, yes. Though I think the Indian culture, we don't have much female smoking and drinking. But yes, if that's coming up, smoking and alcohol is definitely going to affect your bone. The bone mineral density is definitely going to degenerate faster as compared to non-smokers. So smoking and alcohol, if you want to do it in a very moderate. Though I not be saying this, you should actually not do it, but within moderate level, you should start changing your habits. Another thing is what I have realized is the structure of, according to different races, the structure, the joints, the spine changes. So, like now in India, there are culture, the Western culture is, popularizing a lot. But our body, the Asian body, is very much different from the Western world. And the Asians are very much prone for early osteoporosis. So osteoporosis is something, when your bone mineral density goes off, the bones become brittle, and eventually it has the tendency of fracture, which is not very much common in the Western population. And so the Westerns go for a lot of cycling, a lot of marathons, a lot of other physical activities, and these are popularizing in our country as well. But the Asian body is not ready for it. So if you, and now in the software culture, we are seeing, weekends, for weekends, people will go for marathon, people will go for cycling, trekking, and all those things which are new to your routine is going to damage your joints faster, is going to strain your spine, and eventually the degeneration process will become even more faster. So do not adapt to those Western culture which is going to strain your body. If you're adapted to conditions like this, if you're adapted to certain sports in your life, or you have been doing this trekking since a very long time, do continue doing that, but to a moderate level. And every age in your life, and your body will be telling you that your body is ready to accept this much amount of strain, your body is not ready to accept this much amount of strain. So you yourself, you are the correct person who can understand how much strain my body can take. Do not force your body, do not force your body beyond that strain, because then it is going to damage your knee joint, your spine, and other joints as well, to a very very different extent of damage. So understand your body capacity and do things accordingly. So, like Dr. Chetna was mentioning, that taking care of your bone health is very very important. What happens is after menopause, when the hormones withdraw, when the estrogen levels and all starts withdrawing, the bone mineral density in females starts withdrawing, and then the bones become very very brittle. So then we give a lot of supplements of calcium and vitamin D and all those things. But that is, we are trying to, that happens at the age once your bone has become brittle. But it is always better to start preventing this at a very early age. So, like when you're at age, when you're teens and when you're in 30s, start taking good amount of calcium, start taking good vitamin D, have a good vitamin D exposure, so that when you have this menopausal era, when you reach that osteoporotic stage, your thing is delayed. So, like mothers, please do take care of your daughters at a very young age. Promote them to drink a lot of calcium rich food, promote them to take a lot of vitamin D exposure, so that everything is at place, and when you are aging, that is well taken care of, according to what you have done previously. What you would suggest, Dr. Chetna?
Definitely, prevention is better than cure. Our Indian diet is not actually full of nutritive things, and the amount of urbanization, what has happened, the amount of modernization was what has happened has affected our lifestyle too. A lot of fast food, the kind of modular kitchens what are there. where all the females are standing for long hours and are working, putting the knee at risk, and not taking care of yourself properly, not giving adequate fitness regime to your body. All this is adding again. On top of which, most of us are working women. We are trying to balance the work life as well as the family life. In a struggle to maintain a balance between a work life and a family life, we tend to forget ourselves. I think it's a high time that we start taking care of ourselves. We start taking care of some time for ourselves so that we can remain healthy. When we are healthy, we can take care of our families better.
Yes, that's true. What is the nutritional thing? Please do take care of all the women listening to us. Please do take care of your nutritional conscience because those are very, very important. When you think that you are taking good amount of food, your nutritional value should consist a lot of calcium, should consist of a lot of other minerals, because that is going to affect you in your elder old age. So nutrition is one thing. Good adequate sleep is very, very important, because once you take good sleep, the sleep cycle is maintained. All your body, all your cells have good amount of oxygen, and the regeneration process will slow down. And please have good habit of good physical activity. Physical activity, by that I don't mean that you will use for a strain. Do not do a lot of time of stairs and sitting on the floor and all this thing. But maintaining a good health, sedentary lifestyle is not advisable. Please do take good care of your physical activity. And another thing is, sedentary lifestyle, like I said, is very, very bad for not only for the joints, not only for your pain conditions, but also for your other medical conditions like diabetes and sugars and all those things. And do keep all your medical illness under check. Be regular to your treating physician for your sugar, for your diabetes, for your thyroid, because these things constantly keep affecting us. The symptoms may not be immediately seen, but in long run, it is going to affect you a lot. So do see your physician every 6 hourly. Take your tablets, take your medications, whatever you're taking properly, so that your rest of the medical condition is taken care of. Do not avoid escaping with all this, because your health is what you can take care of. It is best, not your family members. So a few very important thing is taking care of your own health by maintaining these important points. And definitely, in long run, when you're aging, it is going to be a smoother aging as compared to when you ignore all these facts. Any experience of this, Dr. Chetna?
Regarding network issues, not able to hear from my end.
These are the few basic things, which we both practice pain medicine in our respective city in Chennai and Hyderabad, and we come across with a lot of geriatric population, like females of more than 40, 45 years of age, and we get patients and they keep asking us, we take this glucosamine tablets, we take this vitamin tablets, we take this calcium tablets. Sometimes they take these tablets with different trade name in multiple times, because they are because they keep on taking tablets on their own. Whatever doctor said, one doctor said something, the other said something, they keep on taking. So self education about the tablets what they are taking is very, very important, so that they don't double dose it. And few important tablets are missed. Few tablets which is required in a moderate quantity is taken in double. So self medication, whatever the patients are doing, needs to be kept in check. So that is very, very importantly done. If you're self-educated about your condition, you should know what are the tablets you are taking, what are the tablets you are allergic to, what are the tablets you're taking for your hypertension, what are the tablets you are taking for your blood pressure, so that when you go to some other doctor, you are in a position to tell everything in detail, and nothing is being missed, and there is no harm happening to your body. So self-education is very, very important. Self-care is very, very important. Some physical activity is very important. Then weight reduction is very, very important. These things are regularly, every day see patients. And these minute things are going to help you so much in while you are aging. So we both are constantly repeating the same thing. Please do take care. And this message we want, at least those are listening to us, that they become self-aware of, if not everything, at least about their health. because if they are healthy, if they are taking care of themselves, they are in a better position, they are more confident and more physically fit to take care of their family members who are dependent to them a lot. So we request you, please take care of your health as much as possible. If you need any help, if you think that something is not good with your health, please seek help from physician. There are lots of doctors, there are lots of health centers, there are lots of clinics like us where we see women health, where we talk about women health. So we are always there to help you out. So it's a request to all the female population watching us, take care of your health. It is very, very important. And how about discussing a lot more on arthritis, Dr. Chetna? Would you like to tell us something more about type of arthritis which we have been dealing with since so long?
Yes, here actually, whatever knee pain is being considered as an arthritis by a layman. Arthritis is something which is two different things. One which occurs because of aging is osteoarthritis, and the other type of arthritis is one irrespective of your age, maybe at an early age, the kind of inflammation what you develop in on different kinds of joint is your inflammatory arthritis, like your rheumatoid arthritis or your gouty arthritis, where your uric acid levels are more, where your multiple joints are painful, they're stiff, they're not able to do, and this is a kind where you have inflammatory arthritis. Otherwise, osteoarthritis mainly occurs because of aging, maybe because of your overweight, or because of the kind of occupation you do, the job which involves long standing, or the job which requires with bent knees, or maybe because of any injury in your knees. These things can promote or start early osteoarthritis. And rheumatoid arthritis or other inflammatory arthritis, yes, we can manage with yes, seeing a rheumatologist and taking care of your joints, especially in winters, and by other medications following which is required for arthritis. Whenever one come across
Correct.
the
And
pain, how you can.
can we also discuss about
Hello, hello,
hello?
hello. Yes,
So can we also discuss a little more about rheumatoid arthritis, because we see a lot of young patients, young females suffering with rheumatoid arthritis. So rheumatoid arthritis is basically an autoimmune condition where your body cells are actually destructing your own cells. So what happens is these cells will start affecting your joints first. So your small joints, the small joints of the hands and the wrist, and then the knee joint and elbows, and then your ankle joints start getting involved, and then you will have a lot of pain, swelling, and then there will be restriction of the motion. Then you'll not be able to make the movements in the joint, and eventually, when you're not taking care of it, it will lead to deformity. What I have seen, most of the patients they come to us who have the rheumatoid arthritis is very high. It is more than 100. Sometimes it is up to 150, 200, and actually the rheumatoid arthritis value should be somewhere less than 20. So what happens is these values are very, very important, because it is not only to take care of your pain, but also to prevent your joint from deformity that can happen over a period of a few years. So patients will come to us and then they're like, no, I am on various other kind of medications, like Ayurvedic, homeopathic, and other natural ways of treating the rheumatoid arthritis. But rheumatoid arthritis is a condition, it's an autoimmune condition. So there are two things which needs to be taken care of. One is the joint pain and the joint destruction that is happening. And the other thing is the cells, the rheumatoid cells, which are auto-destructing, should be under control. So, what happens with those allopathic medications which we prescribe for the rheumatoid arthritis to control will have a lot of side effects. Especially, it goes and affect your liver and your kidneys, and there are lots of side effects. Patients will have dryness of mouth, itching, they will have rashes, and so what happens is, when they are not able to tolerate it, they just stop it randomly, and then they switch over to the other type of medications, like into the naturopathy
alternative
or any
medicines.
kind of ayurvedic treatment. And the rheumatoid factors keep on increasing, increasing, increasing. I've seen a lot of young patients who have come to us who are wheelchair bound, and 22 years, 25 years, and their joints are completely restricted. It's all. But once you are diagnosed with rheumatoid arthritis, please keep a check of your rheumatoid factor. There are factors which you need to, every 3 monthly or 4 monthly, you need to get checked. Is the rheumatoid factor, the ESR, CRP, anti-CCP, and then there are other tests according to your condition which your doctor will prescribe you. Get them checked every 3 months or 4 months. Check your kidney not only for now but also for future. Like I said, the aim is to prevent you from deformity. The deformity should not happen in future. So do not avoid using to take these medications. Definitely, there are some side effects which can happen. So there are lots of medications again, and your doctor can prescribe you one medicine is not suitable. He can give you another one. So do not, skip taking these tablets because these are very, very important, not for now, but for your future. So, rheumatoid arthritis is something which is not similar to osteoarthritis. It's very debilitating in long run. So do not ignore it because it's going to harm you to a larger extent. What is your experience of rheumatoid arthritis, Dr. Chetna?
Many patients, they start with rheumatology, whatever the medications are involved for rheumatoid arthritis. But over a period of time, they tend to give up because of the side effects, not compliant with the medications. Like as you said, a lot of gastritis, vomiting, the rashes. Yes, kidneys are getting affected. So all these are there. But giving up the medications and start switching over to alternate medicines without checking the rheumatoid profile, yes, as you said, it will be debilitating in a long run. So a request is do have a check on your rheumatoid factors or the uric acid levels and take the medications as prescribed by the doctor. That will help you in having a control over your conditions.
Yes. And also there are some, spondyloarthritic conditions where your rheumatoid factor will be normal, but again you will have symptoms similar to rheumatoid arthritis. Okay. So,
Hmm.
when you get your rheumatoid arthritis factor done, RA factor done, it is within normal limit. But definitely some of the other factors like anti-CCP or CRP must be definitely raised. Do not ignore these also because again these are seronegative spondyloarthritis which will have the same effect as the rheumatoid arthritis in future. So do not ignore them. Get it checked. If your pain is not getting controlled, if you feel that the joint is getting there is inflammation, there is edema, there is redness, there is deformity of the joint, get it checked as much as you can so that there is a solution for your problem. And when we come to treatment, apart from the medications, how you're going to take care of the joint, Dr. Chetna, can you tell us about that?
See, many of the ladies, when they come to us, before coming to us, they would have tried many, n number of home remedies. When they fail, like ice fermentation or hot water fermentation, when they fail, they themselves go to the physiotherapist and take some physiotherapy. But when even physiotherapy doesn't give them a good relief, they try to start self-treating by themselves. They just go to a nearby pharmacy, they just ask for some medicines and they take those painkillers, even without having the knowledge of the side effect of those painkillers. So, sincere request in all of you not to go to the pharmacy and buy the medicines directly without any doctor's prescription, without having the knowledge of the side effects of these medications, because these painkillers they come with a lot of side effects. The painkillers can cause side effects like initially a gastritis, which can lead on to a gastric ulcer, which can lead on to even a gastric bleeding. When it is continued and taken without patients, without doctor's prescription, it can lead in future to kidney issues too. So sincere advice is just don't straight away go to the pharmacy and buy these medications and treat on self. Instead, reach to the doctor, consult your doctor in right time so that your problem is identified at an early stage and the problem can be addressed in a correct way. And when they fail, by the time they
Yes,
reach to the doctor, the osteoarthritis would have been progressed to a stage where it lands up ending in having a surgery. So when this word of surgery comes, many females they don't turn up to the doctor for this reason. So if your pain is addressed on a right time, the need for the surgery or the need for the some complicated invasive thing is not required. It can be avoided.
Yes, yes. And definitely, every medical condition will have definitely has medical treatment. So, like I was talking about, we are talking about rheumatoid arthritis, and Dr. Chetna was also mentioning about the medications and how to take self-care. And the rheumatoid arthritis needs to be controlled with these medications. But once your joint has shown any kind of degeneration or deformity, we can take care of that with non-surgery. We have a newer medical identity now, that is regenerative medicine, where we use patient's own blood to repair the joint damage whatever has happened. So that's a very minimally invasive procedure where we take your blood and then we process it. We take the growth factors, your own growth factors, patient's own growth factors, and then we put it inside the joint wherever there is damage, so that whatever damage has happened, it can be stopped and it can be regenerated. So we practice a lot of regenerative therapy. We practice a lot of PRP for both osteoarthritis, rheumatoid arthritis, and of course for other kinds of arthritis also, where the results are doing really good. So it does not have any side effects, it does not have any complication. So these things are available. Once you start seeing your doctor, you will get a lot of awareness about the modalities that is available, because there is a very less awareness that about non-surgical options which are available, because we general public always think that okay, if this is the condition, we should first take medications, physiotherapy, then when it does not work, then we go for surgery. No, the myth is that only physiotherapy or surgery is going to help us. No, now we are in an era where we have as pain physician bridged the gap from physiotherapy to surgical options. So we have this regenerative medicine that has come up, which takes care of all types of joint pain, whether it is knee osteoarthritis or rheumatoid arthritis or any other kind of arthritis, for your knee joint pain, shoulder, ankle pain, for your spine. And people are getting good relief with PRP. So, what is your experience with PRP, Dr. Chetna, in Chennai?
Many patients who are really scared or who are not fit for surgery, they feel suffering is the only option. But no, as you said, it's a good news to all the pain sufferers that even without surgery, just with simple injections, we can tackle your pain. So it's regenerative therapy, which is nothing but a plasma therapy. It is being prepared from a nature's given own blood, where the plasma is separated from the rest of the blood and is injected back into your joint with a simple small needle, without any anesthesia and without any surgery. That's a simple, like very simple procedure. Maybe in a half an hour or so, we can just get back to the work also. Yes, because and there is no being chemical or any hi-fi medicines being added to it, so the question of allergy or complications are not there. And it's your own blood; it's not drawn from somebody's body's blood where you can expect allergic complications. Those things are also avoided. No surgery and no anesthesia. So anesthesia and surgery related complications and side effects can also be avoided. With just simple one needle, a natural kind of plasma therapy for your natural joint, you can regenerate your degenerated cartilage.
Yes, true. And a lot of patients who comes to us, they will ask that whether this PRP is going to affect whether diabetes or hypertension or any other medical issues, or those having stents or suffering with any kind of kidney issues. So all this medical condition is not at any cost going to get affected with PRP therapy. PRP therapy is with your own blood that we take and then we process it and then put it into the joint. So these medical conditions are not going to affect with the PRP, neither the PRP is going to affect your medical condition. So every human is eligible for PRP. Of course, there are certain conditions where we don't use PRP, like those who have a less platelet count because of congenital disorders, or those who are suffering with active cancer, specific cancer. These are two or three conditions where we don't use PRP, but by and large, PRP is one of the safest treatment modality available in medical field, which does not have any side effects, which does not cause any contraindication to your medical issues. So it is pretty very safe. It is done as a daycare procedure. You can resume your work immediately. We get a lot of young patients who come, take their PRP shot, and then they go back to work. So of course there are few modifications which we need to tell to the patients, and the patient needs to follow that. So once you are ready to follow whatever instructions we are giving, PRP is not going to harm you at any cost. So PRP is one of the very good options now available for taking care of your all joint pains. So, Dr. Chetha, we have few questions coming up. Let us take that. We have
Yes.
one of our audience asking that, she is into desk job, and then, when she sits for a long time, the knee starts hurting when she tries to get up after sitting for a long time. So, what can I do to avoid this becoming a problem in long run? So, how would you suggest, how can she take care of that?
See, sitting in one position for more than half an hour is not good. So either you sit or stand, whatever the position you're occupying, change your position for every half an hour or once. So, for example, you're working in a probably office, I assume. If you're working in your office, just every half an hour once, get up, just take a tea break or a water break, or talk to your colleague and come back and can get resume back your work. The other way you can do is do some stretches, hands and leg stretches that will help you out in tackling your pain.
Yes, correct. And if you're overweight, then keep a check on your weight reduction. Exercises are very, very important. And there are other physical activities which you should do without straining your without straining your knee joint. What do you think of the trend of treadmill? Like, what I have understood is the treadmill is very popular now as a source of, for weight reduction. But I have seen a lot of patients young patients going into early degeneration because it strains a lot to your knee joint. So, what do you think about treadmill? Should it be done or not?
I'm not for it. I think because you don't have a control over your speed, you're actually damaging your joint, making it even more worse in a struggle to bring down your weight. There are
Yeah.
different other modalities, yeah, where you can bring down your weight.
Yes, like you can walk in a smooth surface, and you can do a little of walking and all those things. And you should not do treadmill because treadmill is going to strain your knee joint. And this is very common, with housewives. I've seen they because they don't get time to go to the gym, and also what they do is usually they buy a treadmill at home and they want to do the workout, but that's a very, very wrong thing to do. Treadmill is going to affect your joints to a larger extent. So treadmill is a word of caution to everyone. Please keep a check on doing treadmill. And then we have one more patient who was asking if knee pain is very common, what to do from your early 20s to avoid pain in the future.
Best is sitting on the floor should be avoided. Anything which involves squatting, like sitting on the floor, eating your meal, sitting on the floor, performing a puja, all this, it's better to avoid. Second is that, yes, as Dr. Meenal said, having a check on your weight is very important. The present lifestyle is totally a sedentary lifestyle. So do have check on your weight. Maintain an ideal body weight as per your height and not comparing your weight with somebody else. Third is that yes, frequent exercise should be a part of your life. I mean, it should be one as you are having a meal, 3 meals a day. Exercise should be a part of your lifestyle. Walking, yes, important, and sitting in one place for a long time or standing in one place for a long time and working should be avoided. Avoid using Indian toilets and climbing the stairs up and down unnecessarily. If you can avoid, that can save your joint. That can protect your joint for longer run.
So, osteoarthritis is something like the degeneration of cartilage is something that will happen to every human, but not in all human beings. In some it doesn't at age 40, some it doesn't at the age of 70. That the process of degeneration starts after you are 40. So, at the age of 40, if you don't have knee pain or do not strain, at the age of 40 is the time you should start thinking of what's the floor, start stretching. So, you can prepare some kind of weight reduction. So, at the age of 40, like I tell to a lot of patients of mine who come, and also the they say that but she finds it very easy sitting on the floor. So my mother sits on the floor. So I tell to them it's not only for your mother but also for you. because you also about 40, so all of you should start taking all the precautions because the degeneration has to be controlled. The degeneration has to be delayed, and not necessarily everyone will have pain at 40, but the degeneration will definitely start at 40. So that's the right time when you should start taking care of your body, of your joint, and so that you have healthy aging. I hope we're informative, and I hope we were able to reach out to our female population who are in daily basis suffering with joint pains, and they don't know where to go, what are the options, how to take care of themselves. So I hope we have reached out to them and we have provided them information. And Dr. Chetna, any final word to tell to people watching us? So I think Dr. Chetna lost her connection. So this is how, yeah, Dr. Chetna, would you like to give a final words to people watching us?
Not able to hear. So.
So I think she has lost her connection. So finally, I just like to conclude. Please take care of your health, joint. Your weight reduction should always weight should always be a check. Take all the precautions, exercises, healthy lifestyle, avoid sedentary lifestyle, avoid smoking. Do not sit on Indian toilet. Please take care of you and your daughters at a very early stage. Give them good calcium rich food, give them a good vitamin exposure so that the mineral density is always kept at the check. Do not follow the Western culture because our Asian body build is different from Asian culture. If you are into any kind of sports, marathon, cycling, and all those things since childhood, that's a good way to continue. But if you're new to it, do not try to start it at the age of 40 because your body is not going to allow it. So here we are from Epione Pain Management Center. Because we deal with a lot of female patients, we want to convey on this Women's Day some awareness about women's health condition, and we are always there to help you out. And we have Dr. Chetna to finally conclude.
Yes, self-love and self-care. These are the two things which I would like to convey to every woman sitting there. Please take out some time for yourself. Do take care of your knee joints. Give them some rest and please respect the pain too.
Yes, and self-love is not being selfish. So on that note, happy Women's Day to all our friends, and we want to make our nation healthy, and the nation is healthy only when the females in our nation is healthy. So let us take good care, and so we are there. We are from Epion Pain Management Center, and any doubts, any queries will be well taken. You can reach out to us. Thank you so much.
Thank you.